malnutrition. Malnutrition is basically a problem where the energy demands of the body are not being met by the diet. You'll be surprised to know that it's so common that roughly around 7.5 million babies or children in our country suffer from malnutrition, right? So, hello everyone, I'm Dr. Mohd Aamir. I'm a consultant pediatrician and neonatologist at Cloudnine Gurugram. So I'll be today talking about malnutrition, what are the causes of it, how do we diagnose malnutrition, what are the symptoms, and different types of malnutrition. So when we say malnutrition, it means that basically in a general term, it means that the body's requirement are not being met by the amount of feed or whatever we are giving to the baby. So you have a demand-supply equation which is not being met. Malnutrition can be majorly classified into two types. One is a macro malnutrition, the other one is a micro malnutrition. So in a macro, we can understand the major essential items in the food are missing, like the carbohydrates, the proteins, the fats. In a micro, as the word says, micro is small. So here the amount of deficiencies are of the things that we don't require too much in our diet, something like vitamins and minerals. So majorly malnutrition can be a micro or a micro malnutrition. When we say macro malnutrition, there are two things that usually comes to our mind. One is kwashiorkor, another one is a marasmus. So both of these are types of protein energy malnutrition, where the demands of body's demands of proteins and body's demands of calories or the energies are not being met by the diet. These are the common type of malnutrition that we usually see in our kids. So when we talk about marasmus or a kwashiorkor, they both have the same thing, that the proteins and the calories are deficient. But why do they differ? So they differ because when it is regulated, when the body understands that I am not getting enough amount of calories and proteins from my diet, and the body start utilizing its own fats and muscles and to complete the requirement, then it's sort of a regulation. Then we say that the child will end up in a marasmus. But if the same thing dysregulates, body is not able to understand what is happening, why is the nutrition not coming, then the same child can land up in a dysregulated malnutrition, which is termed as kwashiorkor. So kwashiorkor is basically a child who looks swollen. So does not, and the first look will look like emaciated, does not will look like he's lost a lot of weight, but is a child who is malnourished, whereas marasmic child on the look of it will look completely emaciated, and so easily can see that this baby has malnourishment. There are other types of malnourishments. One could be just an underweight child whose weight does not meet the criteria for his age and height. And the second one could be a stunted child whose height does not meet the criteria of his weight and weight and age. So these are the common types of malnutrition. And when we come to describe the causes of malnutrition, the first thing that comes to my mind is frequent infections. So especially in the first 2 years of life, where a lot of things are changing with the child. He's been first breastfed, then he's been switched on to a complementary diet, and so many inputs from everywhere. He's also it's a rapid phase of growth where his brain, his body, everything is growing at a much faster rate than it is to do at any time in his lifetime. So the requirements are really high, and at that time, if the dietary requirements are not met, and if you have frequent infections in that time, the requirements goes still up. So frequent infections will cause malnourishment, and it's also the other way around. Once a child becomes malnourished, his immunity goes down, and that predisposes him to have more infections. So one of the major causes for malnutrition is frequent infections. The second one is a low birth weight. So you're born with a weight which is low. So obviously you don't have that much reserve that a normally baby would have who is adequate weight at the birth. So with that, when you have low reserves, you have low immunity, and you'll end up again having more infections, and you can have malnutrition coming into the picture. So what we see usually is that babies who were born less than 2.5 kilograms at birth usually have a high risk of having malnutrition. Other than that, various other factors like socioeconomic status of the family will also decide or is a good predisposing risk factors for developing malnutrition. So if a family's earning is not adequate to meet the requirements of the child, or if they have multiple number of children in their family and only one earner, then it is difficult to meet the requirement of every child. And so maybe out of those, one baby who is probably having a lesser immunity will end up in having infections, and there is no proper nutrition, economic constraints are there. So those are the kids who are at real risk of falling into malnutrition. Other than that, many cultural practices which are quite common, like early weaning, starting of cow's milk, starting of buffalo's milk, that too diluted with water early in the life, where breastfeeding is required, and at that point the energy requirements, the protein requirements will not be met, and the child will land up into malnutrition. And lastly, I would like to mention the poor health services, which especially in our rural areas, where proper hospitals, proper clinics, pediatricians, they might not be available. So when the proper ailments are not being attended, then the child can go into malnutrition as well. So those are the causes that we should look for when we speak about malnutrition. Coming to the diagnosis, so how do we diagnose that this baby is actually malnourished? So it's actually not a rocket science, very simple. Look of it, you can say this baby is not growing. But then beyond the looks, we also need some subjective, some scientific evidence to classify these babies into some sort of a type of a malnutrition. So for that we have to do is anthropometry. So anthropometry is basically measurements of height, weight and other body stats. And then we have different charts like weight for age. So at this age, this should be the weight of the child, and different centiles are there. Similarly, height for age, weight for height, BMI, and mid upper arm circumference. So these are the common parameters that we usually plot when we have a diagnosis of a malnourished baby or malnourished child. So once we've done that, we've plotted the chart, we know in which percentage or which part of the malnourishment the child is falling. So we then classify them as a severely malnourished child, moderately malnourished child, mild malnourishment, and things like that. So that's how we come to the diagnosis of malnourishment, and obviously all the clinical signs we look for. And then probably talking about the symptoms of malnourishment. So malnourishment is not a disease of one particular organ. So like if I headache or I have a sore throat, and it is localized to that part. But malnourishment is universal. It's everywhere in the body. So all the organs of our body can have some symptoms and signs suggestive of malnutrition. So when we look for a child with malnourishment, we always look for signs and symptoms starting from the top to the bottom. We call it as tip to toe examinations. So in that, what we do is we first examine the hair. So usually complaints will be like the hair is lost luster, the hairs are easily pluckable, you can have dandruff, you can have fungal infections of the scalp. So when we come down, we see the eyes, and the complaints symptoms could be a dryness of the eye. Sometimes you might severe malnourishment, you can have ulcers of the eyes. Then if you move further down, if you look at the teeth, you may have a poor hygiene of the teeth. You can see that enamels have been lost. Sometimes you can notice gum bleeding. Sometimes you can notice the angles of the mouths being, having excoriations. So these are the common things that we look when you move from the face area. When you move down, you will see in a marasmic child, the rib cage is very prominent. It's all bones. There is no mass, there's no muscles. It's skin and bones. So when we come down to the chest area, we might see in a marasmic child, like it's completely skin and bones. The rib cage is clearly visible. We examine the heart. We can have some signs of the heart and symptoms of the heart failure sometimes. Then liver might be involved, other organs might be involved. In a kwashiorkor baby, you might see that the whole baby is swollen. There is a lot of edema. So the face might be swollen, legs might be swollen, and things like that. So there are many signs and symptoms that we usually pick up. when we examine a malnourished baby. So just to summarize, malnourishment can be majorly decided into a macro and micro malnutrition. Then kwashiorkor marasmus are one of the common types. Then we come to the causes. We say that frequent infections, low birth weight, poor socioeconomic status are one of the leading predisposing factors of having malnourishment. Then there are many charts available like BMI, anthropometry, weight for height, and other things that we plot. And finally, we look for the signs and symptoms of every organ to decide what type of a malnutrition this baby is falling into. And once we've decided that, then we decide about how to make things right, how to rehabilitate, and how to treat this baby. Thank you.